Let's ask Betsy McCaughey. She has been a vocal opponent of government intervention in the healthcare industry for quite some time. In fact, I don't know how you managed to haul this thing around with you, but this is the Obama healthcare law.
That's right, and these green stickies mark the offensive sections that are pushing up your premiums right now. Most people got a letter in the mail in the last week saying their premiums are going up. And these are the reasons. The
reasons are that the government, Obamacare, has forced health insurance companies to cover a lot of things they didn't have to. No lifetime limits, no rescissions, covering of adult children up to age 26, additional provisions such as coverage of preventative services, et cetera.
You just put your finger on the important one. The president is boasting that under his new law, preventive care is free. It's not free. The law forces you to pay for all preventive services in full, upfront, in your premium. They're prepaid. So if you choose to go get one of those preventive services like a mammogram, there won't be any copay, but it's not free. You've already paid for it. If you go to a restaurant and buy the all-you-can-eat buffet for 25 bucks, the restaurant can't say the dessert is free. They've already nailed you for it.
You know, they seem to think that the rules that apply to government, that is, you spend as much as you want without worrying about who pays for it, applies in the private sector as well.
In essence, the government can't quite force you to get a colonoscopy, but they are forcing you to pay for it, and it feels almost as bad in the same place.
This term, zero tolerance, she says there will be zero tolerance for this type of misinformation, unjustified rate. What does that mean, zero tolerance?
You know, it's arm-twisting Chicago style, and it's not the first time. Even before the president took office, Ezekiel Emanuel, one of his health advisors, wrote in the New York Times, "Every favor to a constituency should be linked to health care reform agenda. If the automakers want a bailout, they and their suppliers have to go along with the president's health care agenda." That was way back in 2008, and they've been doing it ever since. That's how they rammed this through.
But again, as we mentioned in the beginning, what the insurers are doing is they're responding to the demands of the marketplace. That is, if there are enough competitors around, you can find one. But if you force insurers to do more things, they will have to raise rates. It sounds like zero tolerance for the marketplace.
For the truth as well. There's another reason, by the way, the premiums have just gone up. 50 million people are now in Medicaid. And when Medicaid rolls go up, your taxes go up,
right,
but also your premiums, because Medicaid pays 86 cents on the dollar for care. It shortchanges doctors and hospitals who turn around and try to make up the difference by charging privately insured patients more, and your rate goes up.
All right. Now, we see some various insurance companies here on the screen. The point is that if zero tolerance translates eventually into price controls, that is, where the government steps in and says, you cannot raise your rates to the extent that you need to in order to cover your costs, what will happen, which always happens in price controls, is shortages. When you force people to produce something at a rate that they can't make a profit at it, they'll go out of business. They'll say, the heck with you. I'm getting out of this business and do something else. That means we'll have fewer insurers, which means less choice for consumers.
Yes, but by the way, a lot of this is just rhetoric in anticipation of the election. The Congressional Budget Office warned members of Congress before they ever voted for this that premiums would go up 10 to 13%. And yet members of Congress voted for this law anyway. You're going to see bigger premium hikes in the future.
We shouldn't leave insurers out of the blame entirely, because they went along with this as well.
That's right. They wanted a seat at the table. They were very intimidated by the kind of arm twisting the administration was doing. But you're going to see bigger premium hikes in the future, because beginning in 2014, everybody has to buy the one-size-fits-all plan.
I don't care about the insurance companies per se, but I care about the people who work for the insurance companies. And if they go out of business as a result of price controls, that means our unemployment rolls are going to be even larger than they already are.
And how about consumers who are going to be forced in 2014 to pay for these insurance policies, and they can't afford them? You're going to have to pay for treatment for drug addiction, heroin addiction, something you haven't bought in the past.
Betsy McCaughey on the case. Betsy, thank you very much.